Cells are the bags of potassium, which means it's the most abundant cation in the intracellular fluid and plays a vital role in the maintenance of normal cell function. Therefore, potassium homeostasis across the cell membrane is very critical because in case of imbalance, it can result in different diseases that could be life-threatening. The total body potassium in an average man of 70 kg is about 40 to 50 milliequivalent per kg, of which 98% is in the ICF and 2% in the ECF. 2% ECF is essential for keeping normal plasma potassium, regulated by a diverse mechanism. Of the ICF, 75% is in the muscle and the rest is in the bone, red blood cells, and liver. The ECF communicate with ICF along with the kidney and GI tract. Kidney is the major organ to maintain potassium content of the body. It excretes 90% of the ingested potassium, while the GI tract, primarily the colon, excretes 10% of the ingested potassium. Now, what are the various factors and their mechanism that cause potassium imbalance, resulting in hypokalemia or hyperkalemia? In case of hypokalemia, the hormones that are responsible include aldosterone, insulin, and thyroid hormone. Aldosterone induces hypokalemia by increasing the reabsorption of sodium and excretion of potassium, while insulin and thyroid hormone induce it by activating sodium-potassium pump. Among the drugs are caffeine, theopylline, lithium, diuretics, and beta-2 agonists that lead to hypokalemia. In case of caffeine and theopylline, they increase the intracellular shift of potassium. Lithium alters the secretion of aldosterone. Diuretics block the chloride-associated sodium reabsorption. And the beta-2 agonists increase the skeletal muscle uptake of potassium. Now, the genetic disorder that leads to hyperkalemia includes Bartter syndrome, gitleman syndrome, and liddle syndrome that block the chloride-associated sodium transporter in the loop of Henle due to the genetic mutation. Other conditions that leads to hypokalemia includes alkalosis and increased production of cells in acute myeloid leukemia. Now, in case of hyperkalemia, the drugs responsible are adrenergic agent, Digoxin, NSAIDs, RAAS inhibitors, ACE inhibitors, and beta blockers. Alpha-adrenergic agent and digoxin induce hyperkalemia through the transmembrane shift of potassium outside of the cell. NSAID, RAAS, and ACE inhibitors impair the kidney potassium excretion. Beta blocker decrease the activity of sodium-potassium pump. The genetic diseases responsible for hyperkalemia includes the Gordon syndrome, pseudo-hypoaldosteronism type 2, and Addison disease. Gordon syndrome and pseudo-hypoaldosteronism type 2 induce hyperkalemia due to the mutation in the Wnt gene. In case of Addison disease, there is a decreased aldosterone level. Other conditions that leads to hyperkalemia include acidosis and tissue breakdown, for example, hemolysis, rhabdomyolysis, tissue lysis syndrome, and neuroleptic malignant syndrome. In summary, potassium is the most abundant cation in the intracellular fluid and play a pivotal role in the maintenance of normal cell function. The total body potassium in an average man weighing 70 kg is about 3,500 milliequivalent. There are various factors that influence potassium content, leading to hypokalemia or hyperkalemia. Thank you so much. Keep liking and watching.